Do I need orthotics for knee pain? Can orthotics help alleviate my knee pain? These are two of the most common questions I get asked about orthotics. Whether you're dealing with chronic knee pain or if you've already been diagnosed with degenerative arthritis, you know how much it affects your daily life. Standing becomes uncomfortable, walking's painful, climbing stairs can be a real challenge. And if arthritis is in the picture, there's always that concern in the back of your mind about whether you're heading towards a total knee replacement surgery. Most people don't realize that knee pain and arthritis progression are often caused by poor alignment and uneven load distribution. And that problem frequently starts in the feet. I have seen this pattern in hundreds of clients who've suffered with chronic knee pain. And once introduced a custom foot orthotic, they experience tremendous relief. In this video, I'll explain how poor foot mechanics increase stress on the knee joint, and I will show you the signs that tell that if your pain may be foot related. And stay to the end because I'll help you determine whether custom foot orthotics are the next right step for you in relieving your knee pain. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with a background in gait analysis, biomechanics, and neurology. I focus on solving spinal problems that develop from an unlevel foundation, including anatomical short legs, spinal and pelvic misalignments, poor posture, and foot dysfunction. This channel is for people dealing with chronic back pain, sciatica, neck pain, headaches, and ongoing posture issues that want more than just temporary relief. Here you will get a clear step-by-step strategy that addresses the root cause of your symptoms so you can stop guessing and start making real progress. If you're looking for lasting pain relief, better posture, and a clear understanding of what is actually causing your symptoms, subscribe and start building a stronger foundation from the ground up. I unload a new video every week. Can orthotics actually help alleviate knee pain? Many cases of chronic knee pain are not just a knee problem, they're a mechanics problem. When the feet roll in too much, which we call overpronation, or when the arches collapse or stay too rigid, the lower leg rotates inward. That rotation travels straight into the knee joint. Over time, that uneven load distribution increases stress on the knee cartilage and surrounding structures. This is where custom foot orthotics make a real difference. By stabilizing the foot and improving knee alignment, orthotics reduce the excessive rotation forces at the knee. They help control foot pronation, and they improve overall alignment from the ground up. The other benefit is they also provide some shock absorption so that the impact from walking or running doesn't travel directly up into the knee joint. For someone with degenerative arthritis of the knee, that reduction in stress can be significant. Less compression, less irritation, less cumulative strain with every step. I've seen hundreds of clients with chronic achy knees experience tremendous relief once we corrected their alignment with custom foot orthotics. Orthotics can also be especially helpful in conditions like runner's knee, patellofemoral pain syndrome, and certain types of arthritis where biomechanics play a major role. But here is the important question. How do you know if knee pain is actually coming from your feet or something else is causing it? Because not every case of knee pain is foot-related. And identifying that difference is what determines whether orthotics are the next right step for you. There are some very clear signs. First, pay attention to your shoes. If your knee pain improves when you wear supportive shoes and gets worse in flat, unsupportive footwear, that's a strong clue. Support changes alignment. Alignment changes stress at the knee. Second, look at your foot structure. Do you have flat feet or very high arches? Do your ankles roll inward when you stand? Those alignment issues do not stay in the foot. They travel up the chain into the knee. Another simple indicator is uneven shoe wear. If one side of your heel wears down faster or the inside edge collapses, that tells us that your gait mechanics may be contributing to rotational stress at the knee joint. And finally, consider when your pain shows up. If it increases with prolonged walking or running or long periods of standing, that repetitive loading pattern often points to a biomechanical cause. If several of these signs sound familiar, orthotics may not just help, they may address the root cause of your chronic knee pain. But that brings up another important question. Should you start with an over-the-counter insert or are custom orthotics necessary? Over-the-counter orthotics can provide cushioning, and they can offer general arch support. And for some people, that mild support's enough to reduce temporary discomfort. But they're generic. They're not built for your specific foot size, your arch height, or the degree of overpronation you need correction for, or your unique arch pattern. They're designed for the average foot, and there really is no average foot. If your knee pain is being caused by a specific alignment issue, a generic insert may not control that movement effectively. It may feel softer and supportive for a while, but it's not correcting the mechanics in a precise way. These off-the-shelf inserts I'll often recommend only for kids. The reason being, in kids, their feet are growing rather rapidly. So to make an orthotic they're only going to outgrow in 6 months to a year may not be cost effective. The other thing is kids are light, 40, 50, 60, up to maybe 100 pounds. In kids, those inserts off the shelf and the plastic that they're made with will often last until they outgrow it. In adults, however, where our feet have stopped growing and we tend to wear them for a lot longer, plus we're a lot heavier, you'll generally break them down and they'll only last you for maybe weeks or months, 2, 3 months, and then they're pretty much kaput. Custom foot orthotics are different. They're designed around your foot structure and how you move. They take into account your specific gait pattern, how your heel strikes the ground, how your arch loads under pressure, and how your lower leg may rotate during walking. That level of specificity is what allows them to reduce excessive stress on the knee joint more predictably. For someone with chronic knee pain or degenerative arthritis, that precision matters because the goal is not just cushioning, the goal is to improve alignment and reduce uneven load distribution with every step. And even with that, orthotics are not a universal cure. So the final piece is understanding when they're appropriate and when another approach may be necessary. If your knee pain is primarily caused by poor foot mechanics, improper alignment, or excessive rotational stress traveling from the ground up, custom foot orthotics can significantly reduce that load. By improving the gait and stabilizing the foot, they minimize repetitive strain that contributes to cartilage wear, joint irritation, and arthritis progression. However, not all knee pain is mechanical in origin, and there's advanced degenerative arthritis with a significant joint space narrowing, large structural damage, or instability within the knee itself. Orthotics alone may not fully resolve the issue. They can reduce the stress and they can slow excessive loading, but they cannot reverse structural degeneration that has already occurred. This is why proper evaluation matters. At my clinic in Orillia, Ontario, we perform a thorough biomechanical and gait assessment before recommending custom foot orthotics. We look at how your heel strikes the ground, how your arch loads under pressure, and how your lower leg may or may not rotate during the walking. We assess alignment from the foot to the knee so we can determine whether uneven load distribution is contributing to your chronic knee pain. A podiatrist, a podorthist, physical therapists, or chiropractors can provide this type of evaluation to determine whether orthotics are truly appropriate. Once we've done the gait assessment, the next thing we'll do is palpate the foot and lower leg and make the cast for the orthotic. We do this by having the person seated in a non-weight bearing position. And then what we'll do is we're going to palpate both sides. In this case, I'll just show one. But what we're going to do is palpate everything from the lower leg down to the foot and ankle, and just check for movement mobility and see how everything's functioning so we know how to design the orthotic. The first thing we'll check is the tibio-talar joint, which is the ankle joint, the subtalar joint, the mobility of the calcaneus, and then we'll check across the top of the arch, all the bones of the foot, to see how their mobility is. We'll also check across the metatarsal heads, which is the balls of the feet. There's a small arch across the metatarsal heads that should be there in most people. What that does is help to keep space so the nerves running out to the toes function normally. A lot of people start to lose this arch due to their wearing things like high heel shoes or just poorly supportive shoes that put a lot of stress on the metatarsal heads. So sometimes if people are getting numbness into the toes, this is the reason. A small bump can be added to a orthotic that just helps to open that arch up again. The final thing we'll palpate for, I'll do it on this foot so it's more obvious, is the arch or the plantar fascia that holds up the arch. This is a band that runs from the balls of the feet down to the heel. By extending the toes in the foot, we'll put tension on the plantar fascia across the bottom of the foot. When we palpate this, we're checking for two things. One is acute inflammation, which is plantar fasciitis. This is fairly common in people who have acute pain at the heel or in the arch. The second thing we're checking for by palpating is small nodules in the plantar fascia. This is called plantar fasciosis. This is actually very common. When people get small tears in the fascia, it'll start to heal over time. So as you slide your finger down there, what should feel nice and smooth will start to create little nodules, and you'll feel little bumps along the plantar fascia. This is why orthotics are so important. If you support that, the orthotic will prevent those little tears from occurring and keep that fascia much more malleable. Now what we're going to do is actually take a mold of the foot. And the way we'll do that is using a malleable foam that leaves an impression. We'll take one for each foot. But what we're going to do, again with the person non-weight bearing, is take their foot and set it on the foam. Line it up so the knee is at 90 degrees. And then with the person fully relaxed, we will lock the ankle into subtalar neutral, which is to line straight up and down. Hold that position, and then put pressure through the knee to create the impression. Once we've done that, we'll have them lift their foot out and repeat for the other side. And that'll give us the impression that we'll use to make a custom orthotics from. The goal is not just short-term relief. The goal is protecting your knees long-term, minimizing unnecessary joint breakdown, and helping you to make a confident, informed decision about whether custom orthotics are the next right step for you. My goal of this video was simple. I wanted to give you clear information so you can decide whether custom orthotics make sense for your knee pain. If you are dealing with chronic knee pain or degenerative arthritis, understanding the role the foot mechanics play is important in figuring out the puzzle. Poor alignment and uneven load distribution put real stress on the knee joint over time. Before making any decisions, get assessed by a qualified health practitioner who can properly evaluate your foot mechanics and gait. If you found value in this video, please like it and share it. There are a ton of people struggling with knee pain who do not realize that the foot could be a major factor. Drop any questions in the comments below. I read them and will do my best to answer them as quickly as possible. And remember to subscribe if you're looking for lasting pain relief, better posture, and a clear understanding of what's actually causing your symptoms. Now, if you also have lower back pain and want to understand how the foot can contribute to lower back pain and how custom orthotics may help with that as well, go watch this next video.